and Dr. Tania Pinfold became involved, and which was a great thing too, because she had, there were a lot of young teenage pregnancies in the town at the time, and it's really difficult for young people to be seen going in to find out preventative measures.
At about that time, I also realised that there were other towns elsewhere in New Zealand that had community-based youth health services, and having started working with young people in the high schools, I realised that they would often have other unmet health needs, either those who had left high school or those who couldn't easily access health services out of school hours if they hopped on the bus and went back home to the farm. It was very difficult for young people to have their needs met, and we could see that there were really important general health, sexual health and mental health needs for young people. So at that stage I became aware of the fact that there had been a youth centre trust formed, and the original trust formed back in 1993, but it struck me that getting involved in a youth centre trust would give me an opportunity to grow a youth health service within that youth centre.
And so Tania had this idea that it'd be a drop-in centre. You'd go to that door there to go into the youth centre and that door to go to the medical centre, which was a great idea really, and proved to be really, really successful. So Tania came on board, and I think Dr. Pinfold made a huge difference to the whole enterprise of a youth centre. It was a new concept. It hadn't been tried before. They got some government support for the medical centre in there, and that was really very helpful.
So that was the beginning of Rotovegas Youth Health. And again, there was no obvious funding to put towards such a service, but we went to planning and funding at the DHB, who were working out how to use a fund called Reducing Inequalities Contingency Fund. And I made a fairly strong pitch to them that what we were talking about was reducing inequalities and improving access to healthcare for young people. So we scored that first contract for Reducing Inequalities Contingency Funding, built ourselves a little youth health service within the original youth centre in Hennemore Street, and that service grew and grew, and as it grew we had to keep finding new funding to add on, new staff, more hours, more space, more of everything. And we found that from the time we opened the doors it was a continuous game of matching up the number of students, the number of dollars, the number of nurses, the number of doctors and support staff. So that was a really big, long story of growing something from nothing without a very firm idea of how it would look. But our process was not so much about having a strategy as open the doors and see what happens. And that worked really, really well for us.